I'm Dr. Castanet. Today the topic is sciatica. Sciatica is pain in the distribution of the sciatic nerve. The sciatic nerve is a very thick nerve that starts in your buttock region. It takes contributions from 5 different nerve roots in your low back and your sacral region from L4 through S3. Those nerve roots combine in the buttock region and they continue down the buttock and then disperse throughout the buttock, the thigh, and the leg, providing innervation to muscles, other soft tissues, bones, joints. The sciatic nerve is typically, when it's a source of pain, and by the way, let me make a mild distinction here. When there is pain that goes down your buttock, thigh, and leg, if it extends beyond the knee, then that is sciatica with certainty. When it just radiates into the buttock and thigh, in all likelihood, it's earlier sciatica that doesn't involve as many nerve fibers and so has not yet radiated beyond the knee. But it's also possible that it's referred pain from the low back and tissues in the low back and not pinching of the sciatic nerve roots. In any case, when sciatica is present, typically it happens because there's what we call a space-occupying lesion somewhere pinching a nerve root. Those space-occupying lesions are typically herniated discs or bulging discs. Other space-occupying lesions can be tumors and infections and things like that, but those are exceedingly rare in clinical practice. What's so common is herniated discs pinching the nerve root. There's several ways to treat this. Generally, they're self-limited, but they can make you miserable and your quality of life miserable. If they're bad enough that you seek medical care, then the most effective treatment in my 33 years of experience by far is to provide traction or spinal decompression. Spinal decompression is just the most sophisticated recent iteration of the traction concept. It's much more comfortable, it's much more effective than the crude tables of yesteryear. I treat most people with sciatica with this method, and probably more than 80% will get fine and be fine and not need referral for any other means of treatment. In fact, about 80% of people, the first treatment, are going to get some relief, sometimes very significant relief, because it's exactly what they need to open up the vertebrae and get the disc tissue to recede and get off of the nerve root and go back from its origin. And that's the most effective way to treat it in my experience by a large margin. Occasionally I need to refer patients for injections, epidural steroid injections, but that's really now at this point less than 5% of the patients that I see. Many of the patients I see have had epidurals and they either stopped working or they didn't work, or perhaps they want to try something as an alternative to continued epidural injections. The spinal decompression treatment I use is effective only because it improves the anatomical problem, and as a result, inflammation comes down, because inflammation is a consequence of the pressure on the nerve root. So if this is the nerve root and this is the disc and it puts pressure on the nerve root, you can inject that to help the swelling and inflammation, or you can make an effort through spinal decompression to get pressure off of the nerve root, like that. You don't even have to get the pressure up all the way. You just have to reduce it significantly enough that the patient gets relief of this episode of back pain. Back pain tends to recur over time, but typically when I treat somebody and they get better, I won't see them again for many months or several years because they'll be over this episode. If I can help you, please call me 404-558-4015. Thanks.